Hey, Erica.
Hi.
Um, yeah, so I was giving everyone a couple minutes to join and just talking about what we're going to be talking about today. We're going to be going over a lot of SIBO stuff and hopefully helping people through the process of getting rid of SIBO if that's something that you are currently struggling with. Um, SIBO can be hard to diagnose. It can be diagnosed incorrectly. You could have been given the wrong protocol. There's like SIBO is also seen as like a root cause, but it's actually like a symptom of something else. And if you don't address the something else, then you're never going to get rid of the SIBO. So it's kind of a whole mess. We're learning a lot about SIBO all the time, even in our practice. Um, and I just think it's something that we really need to help people be aware of in terms of, getting better and getting an accurate diagnosis.
It's great. I feel like doctors about half the time will order a SIBO test. Would you kind of agree with that? About half of them seem on board with ordering and half seem not interested.
Maybe half might be a little bit generous, but yeah, sometimes they'll order it. I think what we see conventional medicine doing the most, conventional doctors, is um, telling people they have SIBO without testing.
Yes.
Yeah, and
There
Erica, tell us a little bit about why that's such a big problem.
so there are a lot of things that present like SIBO. So you can't, without an accurate test, I would never recommend someone getting put on a protocol. These protocols are really strong, so they're killing off a lot of bacteria. But if we don't actually look, someone might have very low bacteria overall, so then we could just be making that problem worse. So some other things that look like SIBO, candida overgrowth can look like SIBO. Parasites are a really big one. Um, Food sensitivities even can show up that way. Poor digestion, like low enzymes, can and cause something like that. Or like a sucrose or fructose intolerance. That's another thing you can test for. And it could be just that issue and not full blown SIBO. So there are a lot of things. Did I miss anything?
I think that's a pretty good list of things, and yeah, I mean, and blindly treating SIBO can also make things worse. So just assuming someone has it, like
Yeah.
first of all, it could be something else, but also if you're going to give a treatment for that person, and we now know there's actually three types of SIBO. It used to be just a couple years ago we thought there were only two types, but now there's this crazy third type that's even hard for us to be sure about and pick up on sometimes. We do a lot of work before. It's called, so the two really common types are hydrogen dominant and methane dominant, but the third one is hydrogen sulfide SIBO. And before we agree that someone has hydrogen sulfide SIBO in our practice, we're usually all putting our eyes on that client's test results because that's kind of tricky to pick up on. It will actually look like a negative SIBO test.
And you can have all three types of SIBO at one time. So it can even look trickier on a test when you have something like that.
Yeah,
So,
and
and we don't,
that's wild.
I know,
Like, I just think that's so crazy.
and we don't want to restrict more than we have to. So that's why for hydrogen sulfide SIBO, we have to take out all the sulfur foods. So that just limits food options even more. And we don't want to go there. We try to, expand people's diets as much as possible. So we'll do it when we have to, but yeah, we don't like to have to do that.
Yeah, and that's another really good point too. Like restricting diets unnecessarily, it actually hurts the microbiome. I mean, for a period of time, sure, it can be helpful if you're dealing with food sensitivities, but after a certain period of time, we're not feeding the good bacteria anymore, giving them a whole lot, especially if we've gone low fiber in an attempt to solve digestive problems like that can
Mm-hmm.
help for a little bit. Things might feel better, but they're eventually going to get worse, and it's not sustainable. And I mean, nobody wants to be on a restricted diet, especially if they don't have to be.
So that brings up the point of like the reoccurring SIBO or someone that went on a round of antibiotics but still doesn't feel good. What would you suggest for somebody that has this reoccurring SIBO?
Yeah, I think it's again, looking at the SIBO as a symptom of something else going on and really getting to understand like sure you have digestive problems because you have SIBO, but why do you have the SIBO? So that could be like low stomach acid, it could be structural, it could be scarring maybe from surgery. There's all sorts of things that it could be. What are some other reasons for recurring SIBO that you can
I,
think of?
I was just going to say, sometimes it takes more than one round. So
Yes, that's
especially,
not abnormal. If one round didn't work, it's
yeah,
not time to give up. But I do think it's probably time for another test in case
yes.
the type of SIBO has changed.
So what we find, if you're very high methane dominant, it can mask or cover if there's also hydrogen present. So a lot of times what we'll see is that first round, the methane will come down and then you'll see hydrogen pop up. That doesn't mean that the first round didn't work. It just means that we're continuing to get to a better place. And I'm sure everybody's heard of this, but typically hydrogen dominant, they start out with, they have more diarrhea, that sort of thing. Methane is more constipation, if you think about it. So, and then you could have a mix of the two. Hydrogen sulfide tends to be more diarrhea as well, but it's like the typical, it's not what always happens. So don't, if let's say, but I think doctors might do that sometimes too, or if you don't actually do a test, if you just show up as your symptoms being constipation focused, oh, it must be methane, it's not always accurate. So another reason it's important to test. Now, sometimes it takes different sort of products. So sometimes we try a round of antibiotics and it didn't work. Then we switch to antimicrobials, supplement sort of things. And then some people have to go to an elemental diet. It's not ideal, but it's 2 or 3 weeks where they stay on it's all the nutrients you need, but they're broken down. So it's a very low FODMAP. It's not going to be feeding any of those bacteria, and it's really effective. Last I saw, it was a study done, it was 82% effective at wiping out SIBO.
Yeah,
So
that's pretty good. I mean, SIBO it's hard to get rid of.
yes. And then the complications of it. So that's where it gets tricky. It's like we have patients that have this overgrowth of the bacteria, but then they also have lack of commensal, lack of good bacteria. They have leaky guts, and then they also have parasites on top of it. So we have many patients that have multiple things going on. So it can get really tricky from that standpoint.
Yeah, and I think that's a big key that people miss too, is like, kind of being misled by thinking you have SIBO and that's the problem. Like, there's just so many other things that it can be, and it's very rarely like just one thing. Like, the problem isn't that you have SIBO, it's that you got SIBO, but like, why did you get it? And like you said, if you have something else like parasites going on or two types of SIBO and you're only treated for one type, like, it
Mhm.
can just be such a mess if you are working with someone who doesn't truly know what they're doing, because there are so many ways I feel like you could mess up somebody's SIBO protocol if you're not really careful.
Right. And I always ask if they've had it done prior. I always ask to see the results, not just what the
Yes.
interpretation was, because it's an art to actually read it. Where it spikes matters, how much it actually spikes matters. So there's a lot that it looks pretty simple, two plots on a graph, but there's a lot that goes into it.
Yeah, it's so interesting. And the more we learn about it and the more, you and Rachel have both taken the SIBO course, I'm just blown away by how complex. I mean, there's literally two lines on a graph, but the way you interpret them can be impacted by so many different things. And it tells a story too, right? Like where the spike is, and
Mhm.
um, even like, the starting point with the baseline too. And there's even some, like, one of the most foundational important things about doing the SIBO test, I think, is following the prep diet the day before the test.
Mhm. That it can be complicated, and some people get nervous to even do it. But even more importantly, people that have really bad constipation probably should be doing the prep for 2 days. I know it's not fun, but it's super low FODMAP. It's very bland. It's not necessarily enjoyable, but
Oh, that's
definitely worth it.
interesting. For two
Yeah.
days.
Yeah,
Wow.
because it can take that long to go through. What they're trying to do is make sure there's nothing that could be conflicting. There's no leftover food particles. Some people's transit time is really, really long, unfortunately.
Mhm. Yeah,
Yeah.
and that's so we were talking about maybe bringing in a piece to assess that, like before even.
Yeah.
Every year, just kind of like as a practice, we're working on what can we do better. What are some things that we're missing? How can we just improve as a practice to help people? And one of the things Erica recently brought up is looking at transit time before a SIBO test, which is a really cool idea. And if you guys don't know, transit time is the amount of time it takes for your food to go out after you've ingested it. So from the time you eat it to the time you eliminate food should be between 24 and 48 hours. If it's longer than that, then you're at risk for SIBO because the food is like sitting in your intestines, fermenting, and potentially feeding that overgrowth of bacteria.
Yeah.
Um,
Sorry, I think you said 24 to 48. It's 12 to 24.
oh,
I
12 to
think you
24.
misspoke.
Yeah, yeah,
Yeah.
yeah, yeah.
Yeah.
12 to 24 hours, you should see it coming out. And what if somebody wanted to do that? Would you say the beet test, just eating beets?
Yep, it's about a half a cup of cooked beets. Give it a try and see when the stool changes more of that purple red color. I've
Yeah,
had people that have eaten beets without knowing, and they think that they have blood in their stool or something.
it can be
So it's a
kind
really,
of freaky.
yeah, it's an effective way to actually tell, because it's just because you have constipation does not mean you have poor transit time. And same thing, diarrhea, more prone, it doesn't mean that you have very fast transit time. So it is important to actually test it, and maybe a couple times to see what's your average. Yeah.
Yeah, I like that too a couple times because there's just so many things that can affect digestion.
Mm-hmm. Exactly. I think another big thing with a test, it's important to do the full 3 hour test
Yes.
versus 2 hours. So a
I've
lot of
never
times,
ordered a 2-hour test for anyone, and I probably never will.
yeah, because we need to see what's going on then in the large intestine. So hydrogen will naturally go up in the colon. We'd never want to see that overgrowth of methane. So sometimes we don't have SIBO, but we still have overgrowth of bacteria in the large intestine. So it's something to definitely watch for. I think some of the other things we run into is proper administration. Did you actually take the solution? And then the proper timing of it. That can get tricky. There's a lot of details to the whole thing. Um, Sometimes if you have it done like at a doctor's office, you want to make sure that they mix the solution right. You have it all in the kits that we have. Everything is already pre-portioned. So there's really little to no room for error from that standpoint.
Yeah, that's helpful.
Yeah.
Is there anyone you would not recommend a SIBO test for?
So it's like sometimes yes, there are people I would not recommend it. Sometimes based on their symptoms, we look at it that way. So we always debate like GI effects, the stool test, SIBO, do we need both? Sometimes we start with one and look at the other. You can never go wrong with getting a SIBO test, but there are some really typical or classic signs of SIBO. So when you have pretty much that immediate bloating after eating and after every single meal, even if you bloat with water, it's painful, it's uncomfortable. So that's a typical sign. What do you think? Anything else?
Um, yeah, I would say, I mean, anyone who has bloating probably does need a SIBO test. It's kind of like a classic symptom. I was thinking about a case I had a couple weeks ago where the client was lactose intolerant and was nervous about drinking the lactulose, um, and didn't want to do the SIBO test because of that concern. Um, I haven't really seen it. I feel like we have a lot of lactose intolerant clients who have done SIBO testing and haven't really had major issues. I do think though, like one thing that's really interesting if you're going to do a SIBO test is to understand that because it's like bringing up this overgrowth of bacteria, it's not unusual to feel bad after you do the test, especially if you have it. So I always tell people if, you know, when you do this, just plan, you do it first thing in the morning and it's 3 hours long. And so I just tell them to plan to spend the rest of the day at home just because you don't know how it's going to affect you. And it's better to just plan to be home and to be there than to go out and try to like, you know, do something later and just be feeling really lousy all day. But yeah, I haven't really seen it affect, and I can't remember how much lactose is. I, I don't think it's direct lactose, it's lactulose. So isn't it like glucose and something? It's like a mixture.
It is.
What is it?
Yeah, I still think it's a better test. The glucose test is the one that they use mostly in
Oh, yeah, yeah.
research, but the glucose test is 75 grams of glucose. So it's definitely going to spike your blood sugar. It's very high.
Yes, diabetics. I had someone that I
Yeah.
remembered that for a few weeks ago too, that was looking at doing the test. It was a type 1 diabetic. And
Mm,
um, yeah, that's definitely a consideration too.
yeah. I like the lactulose better. It's so the difference, it's more specific. So it'll be more accurate in hydrogen versus methane. So that's always been our preference of what we do as far as testing goes at our clinic.
Yeah. Um, and then let's see.
I did have another thing I wanted to bring up.
Oh, go ahead.
Okay, so the other thing to take into consideration with these protocols, it's not just adding this antimicrobial or an antibiotic. There is this prep you need to do. We need to make sure that the SIBO aftermath, all the toxins, all the things that are happening in the body, all the die-off is being eliminated from the body properly. So even if somebody is going through their doctor to do antibiotics, we still suggest some prokinetics, which will help with the motility piece. We still suggest helping with the breakdown, the digestive piece of it. All those things are very real. And we have a great blog on SIBO die-off that we could probably add to this in the messages after this live video that I think is always just a helpful reminder because some people experience that die off, some people don't notice anything, but we always titrate and work our protocols based on how someone's feeling. You shouldn't feel miserable.
Yeah. Yeah. The goal is not to feel bad. And if you do, it's a sign that it's time to probably back off your protocol and
Mm-hmm.
maybe add in some detox support and then try again.
Yeah,
Yeah.
exactly.
All right. And I think we've kind of covered all of our points. Are we missing anything, Erica?
No, I think we did. We covered it all. Oh, the one other thing, like glucose intolerance or celiac can show up very similar too. So that's another similar in symptoms. So that's another one that we usually screen for and make sure we have tested. We're going to talk about that in another week. So I don't want to go down a rabbit hole of celiac testing, but yeah, that's another one that can look similar.
Yeah, I agree. Which is another reason the testing for SIBO is just so important.
Mm-hmm.
And as a practice, we honor test results for about 6 months, sometimes a year, depending on what the test was. But after that, we're going to ask that you get another test. And I guess with SIBO too, if you've had test results, you were treated and you're still not feeling well, our response would probably be it's time to do a retest. Um, okay, I think we can open it up for Q&A. I'm going to check the email. We did have an opportunity to email questions. I know we've got a couple people on with us. Does anyone have any questions they want to submit? It can be about SIBO or not, for Erica and I while we're here. One question that came in through email is how, this is actually a really good question. How is SIBO different from IBS?
That's a good question.
It is a really good question. Um,
So, I mean, you can say what you want, but first of all, what I'm going to say is SIBO is oftentimes missed and just diagnosed as IBS because the provider, they do a colonoscopy, they don't see anything wrong, and they're told to, okay, you have IBS, you're going to have to live with these symptoms. So that's very unfortunate. And I think from that past webinar, we had a statistic in there where it takes 7 years usually to first diagnose IBS. So I can't tell you how many patients have come in and they've even brought up to their provider, I think I might have SIBO, and they completely dismiss them and tell them to deal with their symptoms. So
yeah, like why not just offer the test? Like
exactly.
it's really, really, yeah, interesting. Yeah. So IBS, I feel like it's kind of a garbage can diagnosis. It's like, it's a syndrome. Anytime something's labeled a syndrome, there's really no known cause for it, um, which I think really what it is it warrants more digging and trying to figure out why you have the symptoms. But yeah, it's kind of a cluster of symptoms that don't really fit into a diagnosis, and it's not a diagnosis. It's just a condition that you're told you have to live with, whether it be constipation dominant, diarrhea dominant. You can have IBS-C or IBS-D depending on where you're dominant. You can have mixed IBS where you have constipation and diarrhea. Gas and bloating are kind of symptoms of the IBS diagnosis or condition, also. Whereas SIBO is something that's diagnosed through testing. We know there's an overgrowth of bacteria specifically in the small intestine. And it's something that really is treatable with the correct protocol. And that's kind of the key, the correct protocol and the correct diagnosis of the type of SIBO that you have. But it also, again, like SIBO is not the reason you're having problems. The reason you're having problems is that you got SIBO in the first place. So what got you to actually having SIBO?
Yeah, I really like we give a questionnaire that helps us better determine the root cause of SIBO. So definitely when we work with someone, we get them better, and then we put them on a maintenance protocol to make sure that we don't go down that route again.
Yeah. Okay, so another email question. What can I do to prevent SIBO from returning?
Exactly. So it's figuring out that root cause of
Yeah.
what it was. So is it vagus nerve issues? Is it constant stress? Is it poor digestion, low HCl? I mean, there's so many things that can cause SIBO. Sometimes it's back from like trauma in their childhood
Yes.
can.
Yeah, a trauma, like head trauma. I had someone when I first started practicing that came in and all of their digestive symptoms started after a car accident.
Yep,
Like
very
it's
classic.
so interesting. And that goes back to the vagal nerve. Let's talk about that for a minute. I think that's a really interesting topic. And I don't think most people know what it is or even how to fix it if it's not working correctly.
It's the gut brain connection. I'm sure most people have heard of that, but yeah, what does that exactly mean? So the gut is creating these signals, and so when we look at that pathway, it's 75% going up to the brain. So it's crazy the amount of things that your gut is sensing and doing and sending information to your brain, and then only the rest of that 15% is coming back down. And so it's a nerve, right? So we have to work it, we have to help nourish, and it's not going to be something that changes overnight. So that's the unfortunate thing, and I think the hard thing. So when people start doing different practices, it could be gargling, it can be singing, that deep breathing before eating. It seems like, okay, I did it one time, it didn't help with my motility, but it really takes a lot of consistent work doing it in order to help retrain that. And we don't realize how often we sit in that stress state when we're sitting in that fight or flight, it's turning off our digestion. It's causing us to, stop. When we relax, we rest and digest. So it's important all day long to be being mindful of, the state of stress you're in. It's a hard one.
Yeah, I really like the vagal nerve exercises. I just feel like they're things that make you feel good. And if you are kind of stuck in a fight or flight state, they really help to pull you out. Meditation is one, also spending time in nature,
Mm-hmm.
gratitude journaling. That's something that I've started doing this year, and it makes such a difference if I do it, especially in the morning when I'm transitioning from kids to work and I'm a little bit just kind of in between in my head of where it's a transition going from mom to working with clients. But yeah, if I just take a few minutes and kind of ground myself, and it's just very like centering. So I just feel like it's like exercising your vagal nerve or working on toning your vagal nerve. It doesn't have to be like necessarily an extra like thing you have to do every day. It can just be something that you can find a way to like work it in, I think, and enjoy and realize that you like feel better from it. So it's something to like you might actually end up wanting to do
I,
more.
I like that shift in thought. It's not just because we're trying to increase that tone. It'll help all around your mental health, just everything, literally. So,
Yeah.
yeah, I like that.
Okay. I think we've got time for one more question. I don't see any coming in live. Do you, Erica? I am not the
No,
techiest person
I can't. I try
listening.
pushing on the live chat and I can't see anything.
Okay. I think
So,
we're probably okay. I have one more email question.
okay.
Okay, this is a good one. A good one to end on. Okay, what happens if SIBO is left untreated? Like, why do we want to, why do we want to find it and fix it? And what
So
if we
that's so
don't?
interesting.
What happens?
Yeah. So I feel like what we see, the story is so typical of someone is diagnosed with IBS, never was tested for SIBO. They try low FODMAP because that's what their doctor suggested. They find some benefits, even though it's overwhelming and they don't even quite understand from the one-page handout what low FODMAP is.
Right,
So if they
right. I
figure,
wouldn't either.
yeah, they figure out what they can and then they realize, oh, garlic and onions, I can't eat that. And then they keep limiting their diet. They keep limiting their diet even more. And then usually we see a progression, not always. Usually it'll start with that diarrhea, hydrogen SIBO, and then after time it'll turn into a methane SIBO. So then they start to get more constipated and then their foods become less and less. So just following a low FODMAP is not going to get rid of the issue. If you have SIBO, if you have that overgrowth like that, we need to correct it for sure. So you can't just like wish it away. It's not going to go away.
Yeah, I do think though, if you respond well to a low FODMAP diet because of how low FODMAP works, it's a good sign that you probably do have SIBO.
Yeah, great. Yeah,
So you can
that's
use
a
it that
really
way.
good
But
point.
if you do, then you've starved some of the bacteria and it might be harder to get a positive SIBO test. So it's a little tricky. But like, yeah,
Sure.
SIBO doesn't go away on its own. There's some controversy around crowding out SIBO just with probiotics. Maybe if you hit it in the really early stages, but the people that we work with in our practice, I think just by the nature of the people that we're working with, like they really do need the full protocol and proper testing. But yeah, it's not going to just go away or change, I don't think, without intervention.
Maybe the crowding out theory would work for people that have really low commensals. So like leaky gut or really low of the good bacteria, and that could just help, displace some of it. But if everything's overgrown, which we've seen that before, you're just adding more and more, and there's not enough real estate in your gut to handle
Yes,
all that.
you do run out of
Mhm.
space. Cool. Well, this was awesome. I hope
Yeah.
everyone gets something out of this. If you weren't able to join live, this will be on the Facebook group. And if you're watching this or you watch it later, we are doing 10% off of SIBO testing this week. So get with us if you want to order a SIBO test or if you need a retest. We usually do recommend that if you're not feeling completely better. yeah, just reach out. You can message us on Facebook or email the hello@digestiontherapy.com.
Awesome. This was fun.
Yeah, thanks, Erica. This was fun. We'll be back next week. We're going to talk about stool testing, who needs it, why they need it, and all of the really cool things that you can find out from your poop. Pretty fascinating.
All right. Well, thanks everybody for listening, and look forward to, if you have more questions, just put them here too. We'll be answering as well.
Yeah, absolutely. Thanks, everybody. Bye.
Bye.